Dr. Lauren Fishman, first of all, thank you so much for accepting this interview.
What a pleasure.
You are most renowned expert in physical medicine and rehabilitation, as well as integration of yoga therapy and medicine. You received so much support and also praise for the studies that you have done a long time on the integration between yoga and medicine and physical medicine, especially when it comes to the rotator cuff injuries, to osteoporosis. I was teaching some of your methods in the yoga therapy trainings. So usually you are asked about this subject, about the pain, low back pain, osteoporosis, and so on. So now today I'm coming with some different kinds of questions.
Great.
Could you please share with us your experience and on the connection between movement therapies, posture, breath, and mental health?
Mm-hmm. Yeah, well, my first experience was reading Paul Valéry, a Frenchman, poet, who wrote about how he was very depressed. This was many years ago. I was like in college, and I was a little depressed myself. And I read him, and he said he was very depressed until some French river, he bounded from rock to rock along the banks of a river. And he noticed his depression lifted. And and I had had a similar experience myself. And I said, there must be something in that. So I think that's my first connection between movement and one's mental state. And so I think that was first real experience with movement encountering depression and conquering it, overcoming it.
Wonderful, wonderful. So to what extent have you experienced physical medicine and rehabilitation, yoga therapy, helping with mental health?
Good question. I think there's something that Wittgenstein said that is really applicable to this. He said, I think it's in the Blue Book or the Brown Book, where he says, the greatest image of the human soul is the human body. And you see this in rehab all the time. For example, someone has a stroke or a grievous accident, they've lost their hand or their leg. And their image of themselves is quite different. They see themselves as shattered, truncated souls. And when you bring them back to their true level of function, obviously you don't restore the arm or leg, but you restore their image of themselves as a whole physical person, able to do whatever they could do when they were intact. Their psychological state improves apace.
Oh, wonderful. Now taking the subject more towards yoga therapy, how can sitting in a strange posture or changing a pattern of breathing can help us maintain mental health or even return to sanity?
Yeah, I don't think it's a strange posture. I mean, what Patanjali says, the author of the first book of yoga, the Yoga Sutras, is find yourself a comfortable posture. And while it is somewhat strange to us Westerners, the lotus position, if you really work at it, becomes extremely comfortable and something you can hold for a long, long time. And it's strange that the emotions and the intellect that we have has to come from our bodies. You know, we read about disembodied spirits all the time because the spirit is so interesting. You never read about disinspirited bodies. You know, what's it like for a body without, who cares? You know, we're not interested in that. But it does spring from the body. And an analogy that comes to mind, if you wanted to study Aristotle, would you take a magnifying glass to his manuscript and look at the ink very carefully? No, that wouldn't help you learn about Aristotle. It would just be about the printing, the ink. So what? We want to know what he's thinking. You know, how did he develop the way he did? So a better analogy, I think, would be, if you want to learn music, would you look at a Stradivarius violin? Yes, because the violin is important for generating it. And that's the way the human body is for the sentiments, the spirit, and the intellect that we have. I think that's the connection I see.
And you see your patients working with for the recovery of their physical illnesses and injuries, changing also the way they approach life, the way they approach their
Yeah, well, I believe in that. I mean, this is something that just occurred to me a couple of weeks ago. I was thinking of the medicines for osteoporosis. And when I thought about it, almost, not all, but almost all the medicines for osteoporosis truncate, abbreviate, alternate, do something terrible to our bodily systems. That's what they do. Many of the medicines stop the cells that eat up our bone and return its calcium and protein to the systemic circulation. They almost all do something like that. The newest one, Evenity, stops a certain chemical, sclerostin, from going into our system. Well, Mother Nature gave us sclerostin for a reason. We're truncating, we're doing some violence to our system. Then I realized from what I've read in the last couple of years, the latest researches, couple of years, not that latest, I guess, is that all the cells of the body are endocrine cells. They all are sending signals both to themselves, locally, and to the whole body.
Yes.
And these medicines stop the process. So I think of all of us, the trillions of cells in us, like a great big orchestra. And we are every instrument, we're the conductor, and we're most of the audience. We're it. And when they truncate things like that, it's like they change the sound. It's not the same symphony. And yoga is just the opposite. Yoga quiets everything around, so the symphony is clearer. It doesn't do anything to all the, to the oboes are there. The string section is doing what it does. Everything is just the way it's supposed to be, only more so. So that's how the yoga works there, I think. It's a very interesting way to look at it, I think. Yoga doesn't stop anything except the noise.
In our brains, in our
brains,
minds.
yeah.
And maybe helps us deal better with the noise outside.
Yeah, exactly.
Of daily life.
Yeah, damps it down, yeah.
We were visiting last night the Times Square, and it's so noisy. It's so nice.
Really, once I was there, we were going from New Year's Eve, younger, going from one party to another party. We got caught in the traffic eddy of New Year's Eve around Times Square, where 500,000 people used to gather. I don't know if they ever will again. And we could see these drunken faces leering into the window of our taxi. It was quite amazing.
Yes,
you got emotional noise too from these people.
Yes, absolutely. So, your studies on osteoporosis are famous, and
so wonderful that it works.
Yes, I would like you to share us a little bit more about the connection between the yoga posture versus the medication, in terms of timing, in terms of how long does it take for the reversal or the.
What if I show you a graph? Would that help?
That would be wonderful.
Well, let's see if I can get it. Okay. So this is one of the bisphosphonates, the most popular medications around. And this is time. You ask about time. Here's 3 years. So, let me go back. Well, this is how much they help. The red is without the medicines, the blue is with the medicines, about 1/3, 28 to 42. It's exactly 1/3 better that you get. That's as much better as you get with the medicines. Here's Boniva. This is the spine, this is the hip. Look at that takeoff. Look how quickly you get better here. This is for the hip and the spine. Now, this is placebo in red down here. Now, the interesting thing is that yoga doesn't start off as quickly. Yoga starts slower, but yoga stays at the same rate. Look what happens to the Boniva, and this is true of all the bisphosphonates. In fact, it's true of every medicine that I've looked at. After a while, it peters out until here you've got almost a straight line. In other words, you're almost not gaining any bone at all after 3 years. Whereas the yoga keeps on gaining. The line is dotted because I've really only studied the people for 2 years in many cases, so it's a projection. However, I do have some patients that have been in my study and in my toe for 6 years. And it's the same. They just keep getting better at the same rate. So after 3 years, the yoga not only has outstripped the medicine, but the medicine ain't going to get much better. Look at it. This is really almost a flat line. So there's almost no progress, while the yoga is making an increasingly greater discrepancy between itself and the medicines. So why does yoga keep on working? I think exactly because it does not disrupt the normal bodily processes. There's something called Wolff's Law, which is that the architectonic, the underlying substructure, the strength substructure of a bone, the infrastructure of a bone, follows the lines of force to which the bone has been exposed. And that goes on all your life. Your bones are constantly remodeling. There's something called bone muscle crosstalk, which some of the medicines like Evenity interfere with. And the muscles are telling the bones, now you put some more bone over here and never mind what's over there. I may have a graph of that too. Let me see. Oh, maybe I don't. These are what's wrong with all the yin yang of it. This is this is what's going on in the cell. It's something like this. It's not just one tug of war between putting the bone back in and taking the bone. It's a very large number of consequent tug of wars, each one redounding back to another one. They're all interrelated. You can't graph this in 2 dimensions. You need n dimensions to graph it, because these equations go back and affect some of their reagents, their own predecessors, and subsequent follow-ups. So the reason our hips have that characteristic tilt in them here, I don't know if you can show this, there's a skeleton right here. But the reason, when we're born, our hips don't look like this. Our hips are these straight, fat little arrows like this. And over the course of walking, where you're walking with this leg and only this leg is on the ground, there's a cantilevering effect. So the cells, the bone cells way here on the inside get much more stimulation than the ones on the outside. And so little by little, the bones curve like that. And this is not genetic. In children with, unfortunate children with spinal muscular atrophy or paralysis for different reasons, that never develops. At age 5, their bones are still like this, straight. It's a genetic predisposition to create bone where the stresses are greater. And that's Wolff's Law. That's what the yoga does all along. And the medicines, none of the medicines do that. I mean, the medicines don't. Where do osteoporotic fractures come from? Falls and crummy posture. Well, there is no medicine out there that'll give you better posture, that will improve your balance, that'll be good for your strength or your range of motion or your coordination. When it comes to anxiety, yoga is very good, but there are medicines for anxiety, but they impair your balance. So it's not a win. So the yoga has many benefits that no medicine does, plus the fact that it's almost free, without any bad side effects. I mean, what I've given you just now are the side effects. Better balance, better range of motion, and so on. So it seems to me a natural.
What you just told us about the stress and the hips, the stress on the bones, seems to be a very good example, like physical, embodied example of post-traumatic growth.
Well, it's like except
stress growth.
You know, what do they say? The same event is both a catastrophe and an opportunity.
Yes.
Here, we're talking about such small trauma that they really are just, I think that you could just call them influences. I mean, little children's bones, of course, can break too, if their trauma is too extensive. But response to trauma.
I was going in that direction, especially because one of the big fears that I encounter in people, women and people at the age of osteoporosis, is the fear of fracture, the fear that if they are going to move, if they are going to practice a yoga posture, there might be an accident, there might be something happening to them. So then taking a pill seems more safe than doing a
It's
yoga
actually,
posture.
it's just the reverse. The pills are very dangerous. You get, I mean, I've put a list here of side effects of the pills. Wait, I've got one of those in here too. Here we are. When I did this on a computer with a screen this size, it was 14 inches of side effects. Went way down to the floor below me, you know, many different ones. And they're not, to underline the point of how systemic the effects of just affecting one little reaction are. Difficulty swallowing. That doesn't sound to have much to do with the bones. Convulsions. Your bones don't convulse. That's your central nervous system. That's doing that. Vomiting and constipation. That's your GI system, isn't it? Dead jaw system. That's the bones. That one will give them. Swelling of the sex organs and your face. Peeling of your skin. Those are not things that have to do with the bones, and yet it's only a medicine for the bones. The side effects are rampant. Plus, there are spontaneous fractures from taking these medicines. So you're taking the medicine to prevent fractures, and the medicines cause fractures. This is not progress. So, no, they're very dangerous. The yoga, I'll tell you, for us, we have now over 250,000 hours of people doing this yoga and 0 fractures. 0. 0 herniated discs, 0 meniscal tears in the knee, 0 rotator cuffs, cervical problems. We really have only some aches and pains. We've developed in the program that you're using, I don't know if you're aware of this now, we have a beginner pose for people that actually could be in nursing homes and unable to go to the floor. We have an intermediate pose that's a bridge from the beginning pose to the classical one. And the genius of Mr. Iyengar, amongst his other genius aspects, is that as you get better at the pose gets better for you and safer for you, so that you can apply a good deal of effort into the poses, which you must to stimulate the osteocytes to build bone. You can apply that effort quite safely. I mean, there are various august organizations in the United States that find, oh, you can't do twists, they're bad for you're going to have a rotator cuff, you're going to herniate your vertebrae and all this stuff. That does not seem to be true, because we've done so much. I mean, these people do 2 or 3 twisting poses every time they do the poses, which they're doing on the whole, I don't know how many times all of them are doing, but on the whole more than 3 times a day, more than 4 times a week, almost every other day. A little better than every other day. And no fractures. So the proof is in the pudding there that they do seem to be safe. Theoretically, there's an Italian study by Cristofolini and others where they sort of, Frankensteinian, they took cadaveric vertebrae, that's the Frankenstein part, they made holes in them. Here's a vertebra. They made little holes in them to put in pressure sensors. And then they accounted for the weakening of the bone by virtue of the drilling of the holes. So it's a pretty good study, you know.
Yeah.
And then they took these vertebrae and they embedded them in concrete. And then they pressed on them from the top down, from the right side and the left side and the front and the back, and they twisted them clockwise and counterclockwise the way we do in the yoga poses. And they rated, you could see by the sensors, where the pressure is elevated. And I was just very gratified to see that when they did twists, the pressures in the front of the vertebra were elevated. They weren't so much elevated as to produce trauma and break the bones, but they were elevated enough to stimulate the cells to build more bone. And as you know, almost every single osteoporotic fracture you will ever see is right here at the front of the vertebra. And that's what the twists strengthen. So far from being dangerous, they are probably the best poses to avoid that most frequent of fractures, the osteoporotic fracture of the front of the vertebral body. So,
and let's say that this vertebral fracture is the one that eventually is going to...
That's what makes you... I mean, the best indicator of a second fracture is a first fracture.
It's a first fracture.
I mean, in a way, it's a logical truth, isn't it? You can't have a second one until you have a first one. That's true. You know that line in The Hitchhiker's Guide to the Universe? First things first, but not necessarily in that order. So, this is the same kind of thing. You can't have a second fracture without a first. But what the point is that people with the first fracture are more likely to have a fracture than people with no fractures, with exactly the same bone mineral density. That's another thing that yoga does. It turns out a bone is not just the outside of the bone. I mean, the bone mineral density, another prop, only measures the very periphery, the circumference of the bone. This is where all the bone mineral density is, in the cortex. However, there are also trabeculae that crisscross and provide bulwarks and cross struts and stuff that apparently, according to experts, contribute anywhere from 30 to 70% of the strength of the bone. So they're almost as important or even more important than what they measure with the periphery with the bone mineral density, the DEXA scan. So what we're finding, I have a colleague at NYU, Gregory Chang, who is measuring the inside of the bone, and I've sent him 40 yogis. And it's only qualitative at this point. It hasn't gotten quantitative. But qualitatively speaking, the yogis seem to have better bones than the average person. I can go that far. So it does build this inside of the bone. So we have a number of yogis who call me up and are very puzzled. And they say, I just had a terrible fall and I didn't break anything. And I have osteoporosis and they're very disappointed. I say, cheer up, you still have a chance to break a bone. Don't worry about it. But the reason they didn't break a bone is because of those strong trabeculae in here.
Is this also an advantage of the complex nature of the yoga postures, of the yoga movement, compared to maybe a unilateral form of training?
I think so, yeah. There's an excellent study by Everett Smith out of Sheffield in England, who found they took turkeys and they bound down one wing, and they had the other wing do all the weird things that turkeys do. And they found that, it's a more complex study, but this is the most dramatic part of it. They found that unusual pulls on the bone, not the usual pulls you always see, but the weird pulls build bone better. And in a way, yoga does that.
Unusual ones.
Yeah, unusual ones.
So sitting in a strange position. In our country, we say that you sit in a strange position to think differently.
Oh, I like that.
Yes.
I think that's right.
It has a rhyme also for us.
Well, it's societally true, too. Those in the strange positions are the ones that have the original thoughts. Not the ones invested in the status quo.
Yes, correct. Well, your attitude and your sense of humor and your passion is delightful. Will you put it on the behalf of your yoga practice, of your passion for work, or where will you consider your secret space?
My passion is really for people.
Oh,
all my life, I've really always really been attracted to people. Big ones, small ones, young ones, old ones, cute ones, ugly ones. I'm attracted to them.
Human nature. How beautiful.
Yeah.